Obesity is not just about excess weight. It is a chronic inflammatory condition that quietly rewires the body's immune and cellular systems in ways that encourage cancer from the ground up. Behind the physical appearance of fat accumulation is a deeper, far more dangerous reality, a state of persistent, low-grade inflammation that spreads through the body like a slow-burning fire. This inflammation doesn't just accompany obesity. It drives the development and progression of cancer at every stage, from DNA damage to aggressive tumor growth. Fat tissue, especially visceral fat that surrounds the organs, is biologically active. As it expands, it attracts immune cells, particularly macrophages, that attempt to manage the stress and damage caused by overnutrition. But instead of resolving the problem, these immune cells release pro-inflammatory cytokines such as TNF-alpha, IL-6, and CRP. These molecules, normally meant to fight infections or repair injury, become constant signals that something is wrong. The result is chronic inflammation, a state where the body is always slightly under attack, even without infection. This inflammatory environment is highly dangerous. It increases oxidative stress, leading to DNA mutations that serve as the first step toward cancer. The protective mechanisms that would normally fix these mutations or eliminate damaged cells are weakened, and instead, cells with genetic errors are allowed to survive, multiply, and evolve. In essence, obesity lays the groundwork for cancer by creating the perfect breeding ground for unstable, mutating cells. Once tumors do form, the inflammation does not stop, it accelerates. Cancer cells exploit inflammatory signals to stimulate blood vessel growth, angiogenesis, avoid immune detection, and invade surrounding tissue. Inflammatory cytokines enhance tumor survival by turning off cell death pathways and encouraging rapid proliferation. This means that cancers in people with obesity don't just form more easily. They tend to grow faster, spread more aggressively, and resist treatment more stubbornly. This is not limited to one or two types of cancer. Obesity-related inflammation plays a role in the progression of multiple cancers, including breast, colon, pancreatic, liver, and kidney cancers. In colorectal cancer, for instance, chronic inflammation in the gut lining, exacerbated by obesity and poor diet, promotes polyp formation and their transition into malignant tumors. In liver cancer, obesity-related fatty liver disease progresses to non-alcoholic steatohepatitis, NASH, which is fueled by inflammation and often leads to cirrhosis and eventually cancer. Even more concerning is how inflammation interferes with cancer treatment. Chemotherapy and radiation depend on triggering cellular stress and immune responses to kill cancer cells. But in an already inflamed body, the immune system may be dysregulated or exhausted, unable to respond effectively. Drug metabolism is altered, recovery is slower, and outcomes are often worse. Cancer in the context of obesity is biologically different and far more difficult to combat. And yet, the inflammatory aspect of obesity is rarely discussed outside of academic or medical circles. The public remains largely unaware that carrying excess fat is not just a matter of joints aching or clothes not fitting, it's a continual internal assault on immune function and genetic stability. Many still view fat as inert, passive, or merely a cosmetic issue, when in reality, it's an active player in cancer biology. This silence is costing lives. Without direct messaging that links obesity, inflammation, and cancer risk, millions continue to live in conditions that quietly build toward disease. The inflammation may not be felt until it's too late, when a tumor appears, aggressive and advanced, in a body that has unknowingly supported its growth for years. Until we address the inflammatory nature of obesity with urgency and clarity, we will continue to underestimate its deadly potential. Cancer prevention is not just about screenings and early detection. It's about dismantling the chronic conditions that allow cancer to emerge in the first place. Obesity-induced inflammation is one of the most preventable of these conditions. Ignoring it means allowing cancer to thrive unchallenged in millions of vulnerable bodies.